All right. Well, thank you everyone for being here. This is a great turnout. And to those who couldn't be here and joining us at home, hello out there in TV land. Do I stare at the camera now? I'm just kidding. You know, the idea, like I grew up watching the Jetsons, so it's like FaceTime and streaming. But for those of you who don't know me, my name's Dr. Bauth, and I am part of the team here at GCNC. And tonight, we're going to talk about mental health and the brain. And hopefully, if you're already a patient here, gives you a better idea of what we do. And if you're not, and you're thinking of becoming a patient, it also answers a few questions for you. Cool? And so tonight, I'd like to, before beginning, just take a minute to thank our clinic director who couldn't be here, Dr. Mark Ellis. So I've known him for 16 years now. And, we used to talk about doing nights like this years ago, and it's so neat that it's finally coming to pass. And it's something we really enjoy, so we hope that you do as well. Treating patients alongside him has been just this journey of learning nonstop, and it's a real honor to me to be part of the team that he's collected here. And so speaking of the team, I'd also like to thank them in no particular order. Some of them are here tonight, but Doctors Julie Owens, fantastic, Sophie Hose, Frank Patterson, Cassandra Jimenez, and our newest member, somewhere around here, Dr. James Wright. Yeah, feels good to hear, doesn't it, Dr. Wright? Yeah, it does. And how could it be wrong when we've got Dr. Wright? Right? So, glad that got a laugh. Hey, there she is. And so I'd be remiss if I didn't thank them each for their efforts, because without them, I can't do what I do, And then last but not least, our front desk, they keep us on track. So Jonas, Katie, Celine, we couldn't do what we do without them. So just wanted to say thank you for their efforts as well. So, all right, enough of the emotional stuff, eh? All right, maybe a little bit more of the emotional stuff. So what is mental health? Well, according to the World Health Organization, it's a state of mental well-being. And it helps you cope with the stresses of life, realize abilities, learn and work well with others, like, your first grade teacher told you to do. It helps us contribute to our community. It's an integral component of health that underpins our individual and collective abilities to make decisions, build relationships, and shape our world. And the American Psychological Association goes on to echo that in a large degree by saying it's something about being relatively free from anxiety and symptoms, and once again, the ability to cope and deal with the ordinary stresses of life. Now, if you'll notice, neither definition really focuses much on disease, right? But something more optimal. Fortunately, in 2024, we're starting to wake up to this idea that we can eliminate all the symptoms out there, but still not create health. Yes? And so health as defined is optimal, physical, social, mental, spiritual well-being, not just the absence of disease or infirmity. Okay, that's out of the definition, right? And so we're starting to get this idea, right, that health is not just the lack of symptoms, right? And for example, asthma doesn't come from a lack of corticosteroids, right? Headaches don't come from a lack of taking Tylenol. And anxiety doesn't come from a lack of Xanax. Health is more than the absence of symptoms, and emotional health is no exception, right? Cool. Now I could say psychological health, I could say mental health, I could say mind-body continuum, right? What we're talking about, semantics aside, is that deep part of us that feels good, right? And has the ability to feel right. Now we can sum it up by taking a look at all of the things that mental health helps us with and helps us and affects. Everything from how we think, right? Do you think clearly, or are you suffering from brain fog? It affects how we feel. 28 years ago, starting practice in Springfield, Missouri, I had no idea that people described how they felt based on their cultural norms. So I'm from Buffalo, New York. And all of a sudden I'm in this small rural community, right? Surrounded by farmers, etc. I had no idea what half of them were talking about all the time. One of my first patients, horse breeder, right? I asked her how she felt. Well, doctor, I just feel like I've been rode hard and put away wet. I'll be right back. Out to the front desk I went. Reba, my office manager, rode hard, put away wet? Oh, that means she feels agitated. Agitated. Gotcha. Okay, let's begin with this agitation you're feeling, right? One of my other patients, well, I just feel ornery. Ornery. Be right back. Reba, ornery? Well, that's like agitated, but also a little irritated as well. Gotcha. Agitated, irritated. Okay, let's get to work, shall we? So I learned a lot of new words that first year. Mental health affects how we act, right? Are you a social butterfly? Are you a social misfit? Are you a little wallflower that just kind of sticks in the back of the room, don't want to make any waves, or step on any toes? It affects how we respond to stress, how we respond to others. It affects how we make decisions. And we could talk the rest of the night about this list, but if we can make better decisions, man, we could avoid a lot of unnecessary stress. Yes or yes, right? And can we really avoid all stress? I mean, the key word there is unnecessary, right? But if we can learn how to adapt better, how to cope with it, as the definition said, then we're really doing something. Incidentally, kind of fun fact, the word cope, Middle English, 1100s, means to get struck or take a blow in battle and keep going. Yeah. And look at this. Modern day, 2024, stress, perspectives on illness, what makes us be sick and healthy? 3 things: environmental stress, psychological stress, biological stress, right out of National Institutes of Health. D.D. Palmer, 1895, what causes disease? Thought, trauma, toxin. The man was way ahead of his time, right? Way ahead of his time. Hey. So let's talk a few statistics. In 2022, nearly 58 million Americans suffered. 5%, that's almost 20% of the population, by the way. 5% of them suffered severely with some type of mental health disorder. So chances are pretty darn high that you know someone who's hurting. And if they're hurting, you can almost take it to the bank that their friends or family are as well. Why? Well, mostly because of the desire to want to know what to do or to say and not knowing how. Fair? And the thing is, I can say from personal experience, sometimes the best thing to do is just tell them how much you love them and how much they mean to you. It helps more than it's evident, especially if they're a teenager, right? And so, you just share it with them. And so whether it's anxiety, whether it's depression, PTSD, et cetera, what we're talking about here is this continuum upon which, even though these are different diseases and they're different symptoms, and they're classified differently according to diagnostic criterion, there are similarities amongst all of them, commonalities, comorbidities, if you will, that are the same amongst all of them, right? Like mood changes, changes in personality, right? Changes in disposition, challenges with interpersonal relationships, right? Sleep effect is a huge one, right? I'm anxious, I can't sleep. I'm depressed, all I want to do is sleep. I'm OCD. As long as I can walk around my bed 5 times like this, pulling down on my earlobe, wearing my red socks, then I can sleep. And sometimes treatment according to the symptom works great. Other times, not so much. Why? Well, it's like we can treat the effect, but sometimes it's more appropriate to treat the cause, right? So I tell all of my new patients, look, I understand you're here for X, Y, Z, right? And I want to help you with that. But I'm going to treat you. I'm not going to treat the thing. Fair? Fair? Now, I want to go back to what I said just a few minutes ago about suffering silently, because that's a real thing. It's happening less in, let's say, modern times than it used to. But historically speaking, there's been a real reluctance for people to come forward and seek out help regarding any mental health disorder. One of the reasons, they're embarrassed, right? They feel ashamed. They don't want to get labeled. And they hear that from society. Now, this is a global issue. This is not just America, okay? And people just don't know what to say and don't know how they'll be treated, right? And one of the reasons I think, a pretty important one, is look at this chart. 50% of this chart is that people are embarrassed or they don't think it's serious enough to warrant help, right? It's not like a broken arm where you can go in and someone will look at it and immediately address it. Try going into somebody and say, I just don't feel right, right? And sometimes you don't even know what it is that you're feeling. And so to try to describe it, right? Another 30 some odd percent is they don't know how to talk about the issue. They don't think it would be helpful to talk about the issue. Again, why is that? Well, I think a big part of it is we seem to still live in this society where we've got this dualistic mindset that mind and body are somehow separate entities. And as the saying goes, never the twain shall meet, right? And the research flushes this out. So people know that there are mental illnesses within physical disorder, right? Mental issues within physical issues and physical issues within mental issues. But our vocabulary, our vernacular in ways to describe these things and these phenomenologies with some type of gestalt principle isn't there. And so many of us grow up kind of stuck in this idea where we don't know exactly what to say. Even little kids can recognize that they have a tummy ache and they're nervous, but they don't see how they fit together. Fair? And so this idea can be perpetuated and we grow up. And then people go into the healthcare society themselves, itself, and then what do they hear? It's all in your head, right? Look at some of this stuff that German psychologist Wolf Russler says about the stigma attached to mental illness. The stigma attached to mental illness is ubiquitous. There's no country, society, or culture where the people with mental illness have the same societal value of those without, right? And he goes on to say, I know, powerful, right? And he goes on to say that the role of supernatural, religious, or magical explanations still prevails. And I can tell you this like matter of fact, because I have people describe, again, based on their social norms, well, it's like a spell takes over me, or that's when my demons get me, right? Interesting, yes? He goes on to say that for more than any other type of illness, mental disorders are subject to more negative judgments and stigmatization than any other kind. Right? So it's like, the old saying, if I had a nickel for every time I heard. Well, a nickel doesn't buy much these days, but if I had a nickel for every time I heard a patient tell me they were told that it's all in their head, I'm taking you all out to coffee, maybe a nice dessert as well, right? It's crazy the amount of times I hear that. And what's worse is when they're told there's nothing you can do about it. You're just going to have to accept this. This is your norm now, right? Drives me crazy. It's a couple of years ago, I had a patient come to see me, 74 years old. I said, how can I help? She said, well, doctor, I'd like the voices in my head to stop. Okay. How long have they been there? 60 years. All right, tall order. What have you tried? Everything. In and out of institutions, on and off of meds, herbals, homeopathics, right? You name it, traditional, non-traditional, etc. I said, well, I wouldn't expect any change for a year. She's like, great, when do we begin? Wow. She lived her life in this spot where she didn't really talk about it anymore, but she didn't also believe that it was real. Like she believed that there was something she could do about it. So 10 months into the therapy, she came in, doctor, thank you so much. I slept last night without the use of any assistance. By assistance, she meant like headphones, which blared music, or the TV that had to be on so loud to drown out the voices in her head. But she said, last night was the first night the voices were down to barely a whisper. How cool is that, right? But the stigma is real, and people don't know what to do about it, right? Now, personally, I'm a little bit of an optimist. Actually, according to my friends, I'm a lot of bit of an optimist. But I would rather have a mental illness now, 2024, than let's say 500 years ago, right? Middle Ages. Look at some of the stuff that Rossler was saying about. Can we go back? I really want to go back. That's okay. Hey, look at that. Look at some of the stuff that Rossler was saying about the Middle Ages. During these times, people with a mental health issue were regarded as being punished from God, right? Or being possessed by the devil. So they were tortured, they were killed, they were burned at the stake, you know? They were given poisons to vomit, right? To get out whatever was inside of them. They were chained to walls, they were chained to their beds. Just crazy, crazy stuff. Here's another one, bloodletting. It was right when they would cut you open and try to let out all the bad stuff. I wish Dr. Ellis was here tonight because he's a fan of Phineas Bosch, the artist here. But I look at it and I'm like, yeah, this guy, he just wants to take his wife out for a nice cup of mead, but she won't take the book off her head. No, that's not what's happening. But seriously, I love art because it captures, right? Like The Scream by Edward Munch. It captures the angst that people feel when they're dealing with some type of mental health disorder, right? As somebody who works with the cranium therapeutically, my favorite during the Middle Ages, trephination. This is where they would bore a hole into your skull to let out like the vile humors or demons that were in there afflicting you. And look at, as a bonus, you get your cat to be nearby. Who doesn't want a healthy dose of toxoplasmosis while you're getting your skull reamed open, eh? Emotional support. Yeah, yeah. And I'm sorry to say that from the Middle Ages forward, approaches didn't change too much, right? Look, I'm just 54. 20 years before I was born, they awarded the Nobel Prize to Dr. Antonio Moniz in the advancement and treatment of mental disorders by perfecting the lobotomy, right? And so it's like, yeah, for 500 years, that reached the pinnacle of what they had, see? And so, fortunately, the pitfalls of like doing lobotomies on the masses was discovered, right? And so that treatment fell by the wayside for some slightly less radical things like electroshock therapy, right? Like, the induction of comas, right? Put you in, take you out of a coma if you feel any better. No. Sleep deprivation, not really sure who thought that was a good idea, but that was done. Those fell by the wayside. That led to the advent of some of our earlier psychotropic medications. But those all but zombified people, right? And then that kind of led forward into Valium, Mother's Little Helper. And happy to say, nowadays, we actually have got some pretty good targeted meds that help the sufferers, especially the severe ones, to live a more functional and manageable life, right? They're good things. On top of that, we've got fantastic counselors and psychologists who are using updated versions, like whether it's play therapy for depression, lifestyle intervention to like identify hidden stressors in diet or whatever. There's biofeedback to help people get in tune with themselves, right? There's cognitive behavioral therapy for like a bunch of things. So again, 2024, many more safe choices than years past, right? But the thing is, what about the millions? There's 58 million, right? What about the millions who've tried these approaches and still no help, right? Or they've tried the approaches and they can't deal with the side effect of the meds. That's a real one. So just last night, I watched a commercial, right? Picking on no particular brand name, but this particular med is supposed to help with depression. One of its main side effects, increase in suicidal thoughts. So it's like, for me, it's not a dice that I'm comfortable in rolling, you know? And not to mention that, but, well, look, I've got a couple of professional musicians who come to see me. One of them said to me the other day, well, yeah, the Xanax works, but then I can't perform, right? Because the side effect of the med disables them from doing their what they do. You know what the prescribing provider told them? Find a new profession, you know? And it's like, all right, for my older crowd, you know, is that like the Henny Youngman? Like, hey, doc, it hurts when I do this. Well, don't do that, you know? Is that the best we've got? I don't know, right? I just know that I can't do that. Oh, by the way, this person doesn't have just stage fright. They don't have stage anxiety. They get anxiety when they're mowing the lawn or sitting on the couch. So finding a new profession, I don't know where that comes from. But let's say that it's true. I still can't look at somebody in the eyes and say, well, I know that you've studied your entire life to craft and hone your skills to such a degree of perfection that you can delight people the world over with your talent. But maybe you want to take up welding. I can't do it, right? So look at this. Emotion means to move out. Isn't that fun? So here at GCNC, we use a different approach. The brain. Why the brain? Well, as the most complex organ, it controls, coordinates every other organ structure in the body, right? Everything else in the body. And so tonight, I thought it'd be fun to do a little breakdown of what the body is so that our therapies maybe make a little bit more sense. Cool? And so it breaks down like this. In the human organism, us, there's levels of organization. And so you've got the human, but every human is made of organ systems. Now you guys know the systems, your respiratory system, cardiovascular system, endocrine system, digestive system. No matter what system it is, every system is made of organs. Yes or yes? Yes. And so, for example, our digestive system here, our mouth, our esophagus, our stomach, our small intestine, large intestine, liver, gallbladder, pancreas, all of these work in harmony to break down and metabolize our food, turn it into fuel. Cool? But no matter what organ system it is, made of what organs, all organs are made of some type of tissue. Okay? So obviously there's different types of tissue because there's different parts in the body. So you've got epithelial tissue, for example, that lines your cavities or becomes your skin. You've got connective tissue that turns into bone or tendon or ligament, right? You've got muscle tissue that turns into either cardiac muscle tissue for your heart or smooth muscle tissue that lines your blood vessels or skeletal muscle tissue that helps us move, right? But no matter what type of tissue, in what organ, in what system, all tissue is made of cells. Good. What's the relevance tonight? Well, because cellular biology teaches us that whatever we can say about the cell, we can say about the human. Cool? And that's because the cell is the smallest unit of life capable of carrying out all functions of the living thing. And so in essence, your cells are your mini-me's, right? And if we want to study the behavior of our mini-me's, of our cells, we pluck one out, pop it into a petri dish, and observe the behavior. Okay? By the way, for those who don't know, petri dish, just a small little container with a medium there where a cell can thrive for a while so we can take a look at what it's doing. Right? So we pop a cell in a petri dish, and we put a little food in there, and lo and behold, the cell moves towards the food. Pretty cool. Take the food away, put a poison in there, put a toxin in there to the cell. Guess what the cell does? Moves away from the toxin. So one of the things we could say about our mini-me's, about our cells, and about us, is that from an individual cell standpoint, there's a digital response to a stressor. That is to say that the cell will either move towards growth or what provides for its protection, right, and its longevity, or it will move away. I think I said that opposite. It will move towards growth, yes, in any capacity that provides for its survival, or it will move away into protection when it's in a circumstance when its survival is threatened. Does that make sense? And so that response, that either growth or protection, it's very digital, right? It's either this way or that way. You can't be in both, growth and protection. Fair? So what else we noticed about the cells is that not only do they move, but they eat. Cells poop. Cells breathe. Cells reproduce. Cells do everything that we do, yes? How do they do it? Well, it turns out on the surface of the cell, there's all these wonderful little switches, and these switches have a name. And the name is a receptor. And a receptor's job is to scan the environment of the cell and send a signal back to the inside of the cell so that the inside of the cell knows what's going on the outside of the cell. Cool? So a receptor, in essence, gives the cell awareness of its environment through some type of sensation. Make sense? But we don't need to use all those words because as it turns out, there's a word in our dictionary that talks about that perfectly. Perception. Perception is awareness of your environment through sensation. Make sense? Now, everything we say about the cell, we say about the human, yes? Do you have things all over you that give you awareness of your environment through sensation? Of course you do. Your eyes, your ears, your skin, right? And so, whether it's the cell or whether it's the human, perception drives or governs behavior to a large extent. Fair? Cool. Now, in small cellular communities, this is no big deal. Like one cell can share what's going on with the environment with another cell, maybe a couple dozen cells, maybe a couple hundred. But for a cell to do that with all the other cells in the body, too hard. I mean, we're talking 70 trillion cells, the human organism is. And remember, like I said, when we're developing, each cell differentiates into a certain type of tissue that becomes a certain type of organ for different organ systems, etc. So there's no way for that efficiency to keep up. So while we're developing, one group of cells develops into a special type of tissue that becomes a special type of organ system that becomes your control center or your command center for all the other systems. And that is your central nervous system or your brain and spinal cord. Cool? So while an individual cell has this individual awareness, because of the nervous system, the awareness is global now. Fair? That makes sense? So, the brains have this wonderful ability to scan our body, right? Our environment, internal and external, and send an appropriate signal on into to make an appropriate response based on the signal that they're receiving or the stressor that they're receiving. The only difference now between an individual cell and the organism is that the organism's response to a stressor or a stimulus isn't digital, it's more analog, it's graded. So that the signal or the stressor that we're receiving, well, we make appropriate choices based on that so that we don't respond all in, right, to an oven mitt on fire the same way that we would if we were experiencing a 5-alarm inferno. Make sense? So that really brings us back to the signal or the stressor, right? And if you saw Dr. Ellis or Dr. Patterson talk, they gave all these different examples of how all of these stimulus and stressors go into the brain, right? And we've got signals that come from our viscera, our internal organs. We've got signals that come from our skin, from our joints, from our muscles, from our vestibular, our balance centers, from our eyes, our ears, etc., right? So all these signals, all these stressors, these stimuluses are always flooding into the brain all the time. The brain makes an appropriate response and then gives an appropriate response out to the body. Cool? And so, Dr. Ellis talked about what happens when we have sensory mismatches, right? That is to say, what happens when the signals don't quite match up with reality. And he gave an example, right? The example he gave was you're sitting in the car and all of a sudden the car next to you starts to move forward, but just for a second it feels like you are moving backwards, right? So you slam on the brake or you brake yourself because your brain doesn't know if that was real or not. Your perception is skewed, right? And so that was a sensory mismatch that he talked about. And so the idea here is if it's our cells' perception of their environment that drives or governs their behavior to a large extent, and if it's our brain's perception of our environment, both internal and external, that drive our perception and our behavior to a large extent, right? What happens when we have a sensory mismatch that affects your emotional brain? right? So the movie The Matrix, if you're not familiar, this character is named Morpheus, and he's talking to another character, Neo. And in his hands, he holds a red and a blue pill. And the pills represent pills of perception, what he's going to see, right? What his awareness of his environment will be. And he goes on to ask him a question. He says, what is real? How do you define real? If real is what you can see or what you can touch or what you can taste or smell, then real is nothing more than electrical signals interpreted by your brain. And I love that because what is interpretation? Perception, right? And so again, what happens when we have a sensory mismatch that affects our emotional brain or our limbic system, right? And when I say emotional brain, I don't just mean, well, I mean the system in our body where neuroscience teaches us that certain memories and stressors and emotions are processed, right? I'm talking about like things like our amygdala, which deals with our fear response, right? And I don't just mean a scary movie. I mean that thing like when we're walking in an unfamiliar area and it feels like we're being watched, right? Or when we're walking through the woods and it's a wonderful day and a branch breaks behind us and just for a second the heart rate starts to go up or the hair on our skin on our neck stands up because our brain doesn't know if that's a squirrel or a bear. I'm talking about our cingulate or our insula, which deals with pain. And it doesn't matter whether we're talking about the pain from dropping a brick on our foot or the pain from the loss of a loved one. When I say emotional brain, I'm talking about our hippocampus, which deals with memories, both long-term, short-term, both implicit and explicit. Implicit being things like, how do I drive a car? How do I tie my shoe? Explicit being things like faces or names or events, right? That's where I got married. That's where I got divorced. That's that no good son of a gun who took my woman, right? When I say emotional brain, I mean your hypothalamus or your alarm system, right? And I'm talking about all of the things that fire into the brain that, even though are not part of the emotional brain, drive it or stimulate it, right? Like our olfactory system, our sense of smell, which is why you could be walking through a shopping plaza and smell something and you're no longer there. You're 20 years ago in grandma's house, all fat and happy, sitting around the table eating pumpkin pie, right? And so it's like, again, what happens when the brain perceives a threat, but there is none? What happens when the brain's injured and it can't perceive the information accurately? Right? What happens when we have sensory mismatches that affect our emotional brain? Okay? So that's kind of where I live all day, right? And one of the things we do here at GCNC is we look for appropriate function in the various brain activities. Okay? Like these areas in red, these are your frontal lobes. They deal with things like focus and planning and executive decisions. They deal with creativity and movement, but they also keep a lid on or suppress or inhibit your emotional brain. And if they're not doing their job optimally, well, you get escapes of things, right? And you make bad judgments and bad decisions, like we were talking about to begin the presentation. So one of the things we do is we look for certain biomarkers that tell us if the systems are working correctly. So we look for biomarkers for frontal lobe activity, parietal lobe activity. We look for biofeedback and biomarkers that tell us if there's too much tone in the system, muscle tone, structural anomalies, right? And that tells us if your system is wound up. Because one of the things that can happen is you can have a perception of a stress, right? Real or not, doesn't matter. Okay? And your alarm system, your hypothalamic pituitary adrenal axis, or what's long for fight or flight, your alarm system can get triggered. And when your alarm system, meaning your hypothalamus, gets hit, it releases a hormone, corticotropin releasing hormone. And it turns on and stimulates your pituitary gland. Now, your pituitary gland is your master hormone gland. So it secretes everything from vasopressin, which helps us modify our blood pressures, to oxytocin, which is released massively if we're like falling in love or making love. It releases thyroid stimulating hormone, which tells our thyroid to release thyroxine, which is like your most important hormone for day-to-day metabolism, right? And for our purposes here tonight, it releases adrenocorticotropic hormone, or ACTH. And when ACTH is released and it stimulates your adrenal glands, perched up here on top of your kidneys, they release their hormones, also known as cortisol and epinephrine, commonly called your stress hormones. When your stress hormones are released, the blood preferentially shifts away from your growth organs or your viscera into your protection organs or your musculoskeletal system. Cool. Simultaneously, the blood reroutes from your frontal systems, your executive areas, into your hindbrain, your midbrain, your brainstem, your medulla, right? Your cerebellum. That's what gets you prepped for fight or flight. It activates your sympathetics and you're ready to go. Cool? Make sense? So, one of the things people ask me is, well, what do you do here? And the response is relatively simple. I look for stress postures, right? Now, a stress posture is a normal thing that becomes a not normal thing. What I mean by that is an easy way to look at a stress posture is this. You think of a dog or a cat in response to some type of stimulus or stressor. Cool. The back arches, the tail tucks, right? Maybe aggressive, maybe submissive. Doesn't really matter. If you saw it for a day or so, you think, whatever. But if you saw it a week later, a month later, a year later, you're like, hey, something's seriously wrong with this animal, right? Well, all mammals, including humans, have these stress responses, but humans, fortunately for us, can get stuck in them, right? Remember our old friend, the amygdala? When it starts receiving all this information from your somatic system or your musculoskeletal, your protection system, okay, it can wind up and literally get caught in like a fear loop. And so the output of that area starts to become one of hard to relax and let go, right? And I hear that all the time, like, Dr. Bauth, I experienced some stress, but it was 2 years ago. It was 10 years ago, whatever it was. But now, ever since then, I haven't been the same. And it's like, I just can't let go. I can't relax. I go to bed and I lie there and I just keep thinking about my day. I'm sitting on the couch and I'm trying to relax, and all of a sudden my heart starts going crazy, right? Or I can't poop, right? I just can't relax and let go. Incidentally, fun thing, as I said, cellular, human, right? Same effects. That same way that cell moved towards that food or away from the, from the poison, it's the same way that we do it. Cellular biologists call it a backbone, right? Say that I just say it, it's pretty cool that your cell's got a backbone, but they call it your cytoskeleton that allows it to do these things, right? And so whether it's a real or a not real or a real stress, your system can engage the same way, and you can wind up caught in that loop where it's just hard to relax. Right? Another stress posture that I look for, I refer to it as a conditioned stress posture. And this is when we don't learn things that support growth, or worse, we learn things that promote protection, right? And what happens is we get these sensory mismatches because our subconscious has these little self-limiting thoughts, right? And they become at odds with other things that we're trying to accomplish. And a lot of times these are harder for the doctor and the patient to realize because they're formed in the first 7 years of life, and people put them off as like personalities, but they're not, right? They're more subconscious belief systems. And so it's like, am I good enough? Am I smart enough? Do I deserve love? Do I deserve happiness? All of these types of things. And it's like, these are the things that can really get you after a while, because you're trying to accomplish one thing, but inside your system is saying another. Fair? So everyone knows somebody who's like, well, I don't know what it is. I always seem to attract the same type of person that treats me like so-and-so. Or, if something bad's going to happen, it's going to happen to me. I can guarantee it. I can't just catch a break. I don't understand it. Right? You've heard these things, yes? Yeah, it's pretty common. And so what we do is we look for these stress patterns and we remove them, right? And when we do that, then the system can reroute itself away from that protection mode back into growth mode. Does that make sense? Okay. So one of the things people ask me is, what can you do about it? Like, what can you do from a day-to-day thing that helps your emotional brain fire for happiness, right? Well, Dr. Ellis hinted at it in his last lecture when he talked about depression scores being lowered by Botox. So the take-home message wasn't like, hey, let's go get Botox. It was your somatic system fires into your emotional brain. Your musculoskeletal system fires into your emotional brain. When you modulate it with that chemical, you change the output of the emotional brain. So one of the things that you could do, sit up straight, right? They took 100 people and they said, you 50, you're going to walk around all day upright. Everything you do, reading, eating, watching TV. The other half, everything slouched, right? They did a pre and a post blood level analysis on serotonin and dopamine. These are like your happy hormones. Guess who had the better outcome scores? The upright ones, right? So Sister Mary was right. Sit up straight, right? You could do that for yourself. Another thing you could do, try to view the world differently, right? Try to view that person that says life happens for me, not to me. Right? Get up in the morning and try, good morning, God, instead of, oh, good God, it's morning, right? Because at the end of the day, you have a brain, and it controls and coordinates all the other structures, organs, and functions, and it does so by modulating the sensory input from your body and your environment and making an appropriate response outward. But if these inputs, these sensory things get skewy, then your outputs can wind up becoming states of depression or anxiety and phobias and what have you. So if you know anyone, send them over for a complimentary consultation, right? You may never know how far-reaching something you may say, think, or do today can affect the lives of millions tomorrow, right? With that, I'd like to open up the floor for questions or comments. Yes?
So you had mentioned that you identify the stressors with the patient and then you remove them. Can you go a little bit more in depth on how you specifically remove them?
Specifically, no, but generally, yes. So the question is, for our at-home audience, can you talk a little bit more about how you remove the stress patterns? And anything goes, really, because again, what we're doing here is we're looking at overall brain function. And so it's still an individual with an individual pattern. Fair? And so one person is unique. And even though they might have anxiety, they're going to get treated differently than the other person with anxiety because their system might be wound up differently. So while one person might need vibration, another person still might need light, another person still might need sound, another person still might need, gaze stabilization exercises in combination with manual therapies, right? Because it is an individual basis. But then it just goes back to how are you going to treat it? How are you going to get that system, that frontal lobe, that parietal system? How are you going to get the gaze, the eye tracking? How are you going to fix all those things, right? And so that's, yeah, specifically, but generally that's how we do it. Yeah.
We got a couple questions here.
Couple online?
Yeah. Nominated Monday asks, if a person is dealing with MPD or multiple personality disorder, how do you address the emotional trauma? Also, how do you know which personality is the true person?
Yeah, that's a trick. Yeah. I don't. In my dealings with multiple personality disorders, I don't. And quite frankly, I can't say in 28 years that I've worked with a whole bunch. I have worked with a few. And so the exam generally flushes out the treatment, right? And then I just go with what I see at the time, because the way this may ruffle some feathers, but the way I look at it, I hope I catch them all. I hope I catch all the personalities, right? Because I'm going to work on all of them. And the thing with multiple personality disorders, those are some pretty intense things, right? If anyone's ever studied on these things, they can have different blood chemistries, right? It's really amazing. Yeah. One can be like allergic to bee stings and another one not, right? And so you want to work through the whole gamut. I do, so that I can continue to clear the system out as good as possible, because whatever personality it is still going through that entity that's in front of me on the table. Best answer.
Cool. Anybody else in the room?
Yes.
I just want to say thank you for, I've worked with you for like 6 years, and I had no idea what it is that you did this whole time. To hear you say different stress postures actually was really nice. Now I know.
It's taken me a while to put it all into words.
I appreciate it. And I have more of a philosophical question. What's your biggest takeaway after working with so many people for so long? What's something that like you really take with you every day after seeing how people work on such a deep level?
What's something that I take away from working on people every day in terms of, I'm not sure.
Emotionally, neurologically, like however you want to answer that question.
So I think what I take away is that we have a lot more in common than we think, right? And I think to a large degree, one of the things is we live in an on guard or get ready society, and so we talked about conditioned stress responses, and the thing is, perception of stressor or perception is a huge part of your external environment every day, all day long. And so many of us live in this idea that we're separate from one another, and we have so many things that are divisive and so many things that separate us. The reality is, I've talked to people who vote this way, that way, wear their collar this way, that way, are single, are married, different orientations, etc., lifestyles. But at the end of the day, all of them want like something better for their kids than they had. All of them want to have more happiness in their life. All of them want less strife, right? So there's a lot more that we have in common. So that's what I take away, is that no matter where you're coming from in your problem, you're kind of the same. And I wish people could see more of that, because I think it would lead to less divisiveness.
Yeah, that's awesome.
Yeah. Yeah.
Is there any psychological intervention offered at this place, or is it mostly physical?
Can you reiterate the question?
The question was, is there any psychological advice or therapies offered here? Or is it more physical? It's more manual-based therapies and non-manual-based therapies, because what we would do is, as we mentioned earlier, like turning in a chair or shining a light in your eye or doing a gaze stabilization exercise, you can take varying degrees of opinion on whether that's a manual therapy or not. It is something physical, right? But at some level, if you're giving somebody a scent to smell, it's not quite the same as maybe doing some manual release on their body. Fair. But no, there's never a time where I sit back and stroke my would-be beard and say interesting and let's talk about your mother, things like that. Although things like that come up a lot. And so some of the techniques that I do, like I do certain techniques called neuroemotional technique, and that does focus on emotional stressors, but not from a standpoint of a talk therapy, but more so to identify that, so that when we're doing our other part of that therapy, we can remove the charge or the trigger for that person. Not at all. And just so you know, there's an explanatory pamphlet up front for you regarding that particular thing. But yes, so there's not too much of like, how do you feel about it? And the reason is, there are people out there, wonderful cognitive-based therapies, psychologists, and they have their thing, right? And so I'm going to answer the question by kind of giving an analogy of, and I even think I have a slide for this, which is great. Yeah, here we go. So in terms of the processing of the mind, conscious versus subconscious, your conscious mind can really only deal with about 2,000 bits of information per second. And that's like slow and creative, where your subconscious mind deals with about 4 billion bits of information per second, right? And it's fast and it's habitual. And so it's like, if this screen represented the sum total of mind capacity, conscious and subconscious, the conscious would be just a speck, right? And so while we can sit there and discuss and debate ideas, we're really kind of on the surface of the underneath driving thing, right? So here what we try to do is try to work a little bit more with undoing the subconscious belief system with other therapies that go along with that, right? Not just talking about them, if that helps. You're welcome.
How soon in life does someone's emotional brain start becoming active?
So, the Jesuits used to say, give me a child till they're 6 and you'll have a Jesuit for life. And I think they understood the principle of how the mind develops. So in the first 2 years of life, your brainwave pattern is theta and delta. And this is like hypnagogic. It's pure subconscious, right? And it's not until you reach the age of 6 that you start tapping into, I believe it's alpha, and then you hit beta, I think around age 10 or 12. And that's calm consciousness when you're an active participant in the storyline. Up until 6, you can regurgitate, you can mimic quite well, actually, but you're not really a conscious participator of the information. And so that's like after birth. However, there is things that happen before birth that tell us that the fetus is quite aware of its environment and the parent's environment. And so I've actually got this cool little video that hopefully I can go back to.
Hold on once.
Yeah, it's working. And so,
Hold on.
we're going to do it?
Sorry. Yep. Try now.
Okay. So this is a real-time video of an argument taking place and then the fetus's reaction.
Quando un bambino nasce.
Try going back and forward again.
Mm-hmm.
Everybody at home can hear it,
Oh, really? Great.
but nobody here can.
Okay.
Sorry. Hold on.
So I just want to play it one more time just so we can all see it.
I apologize.
Not at all. By the way, when we played it the first time, did anyone catch the jump, right? And so what you couldn't hear, and hopefully we can hear it again, is this argument taking place in Italian, and there's some dishes breaking and some screaming going on. And every time it does, you'll see the fetus jump. Can we go back?
Yeah. Hold on one sec.
It's a great question. I didn't film it. No, actually, this video was sent to me from, I don't know if you guys know Dr. Bruce Lipton. He shared this with me, and I've used it ever since. It's just such a great tool because people want to know, like, hey, does any of this stuff matter, like before birth? And it's like, yeah, it matters quite a bit. This actually is part of a commercial in Italy for conscious parenting, right? Where they talk about, like, hey, be careful what you guys are talking about and thinking about, because it affects the little one.
It's just not gonna work for me. Sorry.
So technical difficulties, but you saw it, right? So the jumping that was there was in response to the crashing, etc., and the screaming. So,
Quando un bambino
there was some
nasce.
dishes breaking there. You can kind of hear it subtly in the background. Yep. Everyone at home heard it. If you guys want to go home and watch it. But so that answers the person's question. Yes, so we're sensitized pretty quickly, right? And then that's the importance of conscious parenting. Is it's not just what you do after; it's what you do before. And since we're here and on topic, I think this is a study, I think, out of Nature, where they did they took a look at the baby's brain. The baby's brain of the mice was born from a mother who was under severe stress during the pregnancy versus one that was not under severe stress. And you could see the difference between the forebrain in the nurtured mouse and the forebrain on the protection mouse. So to the parent that was the mother who was largely under stress, they basically bore a street fighter, right? To the mother that was nurtured, they bore the intellectual. That's not to say that someone doesn't have an intellectual capacity if they were born to the parent. It just says that doesn't lie, right? Right. That's a pretty marked change between the two. So.
Can you change that?
Can't change. Well, you're not going to change that, but you're going to change the wiring, right? You're going to change you're going to change expression, right? Yeah, because that goes back to, and again, this is like since the beginning of time, right? Nature versus nurture. And at one point in time, there was this idea of genetic determinism, right? That has kind of fallen by the wayside because of the understanding of epigenetic control and epigenetic factors. And so it's like at one point in time, it was DNA to RNA to protein, and that was the dogma, right? That was the primacy of DNA. But that was because the thought was that the nucleus was the command center. But once they started enucleating the cells, taking the nucleus out, and the cell kept living and pooping and eating, right? Cell kept doing everything without the nucleus. It's like, well, okay, that can't be the command center, right? And so the primacy of DNA started falling away, especially after the 1990s, the Genome Project there. So after the Genome Project came out, and Dr. David Baltimore, like one of the world's leading geneticists, is like, what gives us our complexities as well as our traits, what gives us our abilities, not only for health but of sickness, remains a challenge for the future, right? So as an admission that, hey guys, it's not the genes like we thought it has been for the last 100 years, right? So it's more of an epigenetic, and then that can change based on your environment for sure.
Cool. Yeah, we got another one. So how do I know if how do I know if I am in a stress pattern?
It's a great question. Yeah, how do I know if I'm in a stress pattern? Well, I think it's a difficult answer because if you're in a stress pattern from the beginning of life, that's all you know. That's to me, that's the allegory of the cave with Socrates, right? It's like if it's all you know is this one way of life, then you don't know any different. And I've actually met and had patients who were born into some pretty horrific situations, and it's just like a transfer of one thing to another, on and on and on. And so they don't know. But I think if you're, Newton said that truth is the offspring of silence and unbroken meditation. And so I think that if you can manage a spot of stillness enough, you can feel something's not right, right? I don't know if that's across the board, but I believe that to be true to a large degree. That's a great question, though. You had a comment on that?
Yeah, I would also presume that if someone were to begin working with you or someone else here, another person that could help them with their physical body and mental body, and they might be able to show them another way of living that could break them out of that cycle and create like a release of the thought pattern or stress pattern.
Right.
Yeah.
It's great.
Just wanted to mention that.
Okay.
Anybody else in the room?
Anybody else in the room?
Did you study biopsychology at all, or is this just chiropractic?
Smatterlings. Yeah. I mean, it's like when things come across my desk, I look at it, and I try to see how I can fit this in to what I do. Yeah.
Beautiful.
Yeah.
That's fine.
Somebody online?
All right, here's another one. How can you address the trauma of a person that doesn't accept that a trauma occurred?
Yeah, I mean, I think on the surface, that's a great question. And I think, I don't know if it's necessary that the person has to know that it's occurred. I think one of the myths in any type of successful healing is that you need to be in touch with everything that's happened. And I just don't think that that's true. I've seen too many people come in begrudgingly, right? Because their spouse was there, and then like, you're going to go in for care whether you like it or not, And it's like they're there not because they want to be, but because their parent is making them come, or their spouse is making them come, or significant other or partner, and they're just there kind of going through the motions. And as you go through the motions and your system starts to improve, you can start. I mean, one of the greatest parts of being a human being is our ability to look at ourselves objectively, and you start to feel changes. I think it was Emerson who said, once a person's mind is stretched, it never regains its original dimension, something along those lines. And so I don't think it's necessary to really embrace that something bad happened to you or even know that it did. I think it's going through the steps and realizing, like, hey, something is better. And then you just reflect back and go, maybe something was off. That's just my 2 cents on it. Please feel free.
I have a question about, is chronological age a factor in your work?
Not so much.
Young, old,
No.
no matter when you start.
No, not so much. No, but it's easier to work with the youth below a certain age because they don't have biases, right? They just don't have biases, It's like, I often thought about going into like equestrian work, It's like, they don't have biases. Like, I'm not supposed to get better. One of my patients one time, she started care when she was 82, and after like this 3rd or 4th visit, I remember her getting up and looking at me. She just had this look on her face, and she's like, and I was like, does that feel good to you? And she's like, oh my God. And then her husband was over there in the chair, and every time I noticed that he would like sit there like this, just watching what we're doing. And I said, when are we going to get him? And she goes, like that. And so I said to him, hey, when are we going to get you in here? Well, I'd rather die in pain. And I was like, oh, okay. So I'll just leave that one alone, right? Because ultimately you got to make the choice to do it, right? You were going to, I think, add something to the earlier comment, though.
Just for clarification, so you're saying that even if someone is not all that motivated, you've seen so many cases where they're brought in and they go through the
They just start
exercises.
hitting it, yeah.
Yeah.
Yeah, when you increase people's frontal lobe capacity, you turn something on inside them that they start to recognize.
So for example, if I work on a college campus, and so I'm just curious about this. If, for example, someone's depressed or starting to have some suicidal thoughts, is that the kind of shift that we can expect too?
Well, you hope for, right? You hope for. There's a whole lot of variances, right? And there's variables that which is one of the reasons that here I do make the statement, hey, I'm not here as your licensed psychologist or counselor. And if there's a case of serious suicidal ideation, right, then you do want to address that with the appropriate people. But we should be a part of that approach because of what the effect that we can have on the frontal lobes, right? And when those work better, you make better decisions. Personally, when I was 7, I didn't have the words for it, but I was a depressed little dude, right? I used to stare out the window pontificating life. Like, what is the purpose? Why bother, right? I should have been playing with my Legos. But I'm just sitting there like, what is the point? Fortunately, and that stayed with me for a long time. Fortunately, my mothers always know something's off. My mother gathered something was off, and she called an intervention. And there was a psychologist there, and I walked in 14 years old like, oh, crap, what did I do? Right? So they start in, and within a few minutes, my mother's talking about her heart breaking, and she starts to cry. Now, I'm an Italian raised Catholic. There's nothing you could do worse than to make your mother cry, right? So at that, I'm like, I'm good. Nothing more to see here. Let's go get something to eat, right? Because I deflected, right? People do that. But nonetheless, just that experience alone kind of starts waking you up to the idea of, okay, maybe this isn't normal. There's an underlying principle. What is it? Maslow's hierarchy, right? There's like self-survival, and then it's like, how much does your experiences beat that down to where you don't care anymore? It's like, I don't know. I've seen some pretty depressed cases, right? And I can't tell you which ones are going to get better, which ones aren't. I just know that if you show up and do the work, sometimes some great things can happen. Yeah, I hope that answers.
What would you say is the percentage from your experience?
I don't think I could give you one.
Okay,
Yeah, I don't think I could give you one.
thank you.
Yeah, you're welcome. Anyone else? Any online?
Yeah, we got another one online.
All right.
So, how do you guard against and process your emotions after working with others going through such intense challenges?
So I
Let's put this back on you.
I feel like we all just leaned in together.
right. Well, so when I started, I used to get pretty zapped when I would work with people. And then this is my experience. It may work for you, it may not. Just take with it, what you gather. But when I got that first real major one, it kind of set me back, and it's like kind of a little antsy about doing it, And then it was like, well, how do I guard, and how do I do this, and how do I do that? And I did it. I mean, I tried everything that people talk about, from everything like the special bracelets and, washing my hands and whatever, right? But I ultimately got to a point of where I started to realize that, like a baby in a room where people are fighting, it's agitated, or where people are happy, we're all sensitive to each other's energy field, if you will, right? And that has been taught out of us, or shall I say, not encouraged for us to really embrace. And I think for me, it was just a realization that, that was not mine. It's not mine after I leave the room, And it's like, from every grain of sandal, shake from, every grain of sand, shake from your sandals when you leave. You just like, hey, you leave it at the door. And the more I did that, the more I just realized this is this person's stuff and it's not mine. Then I just became comfortable with working on it and didn't feel hit by it, right? And so, like in chiropractic, there's this saying, like a candle loses nothing by lighting another candle. And it's like, if you can keep that idea in mind, then you just do your work and you move on. Yeah, somebody.
How long did it take you to get to that point where you just were able to shake off the
Several years.
Okay.
Several years.
That's still pretty quick.
Several years.
Yeah.
Didn't feel like it.
Yeah.
It didn't feel quick. Yeah.
It seems like for a lot of folks dealing with quote unquote mental health issues or mental illness, that by the time they come to a center like this one, and there aren't enough centers like this one, they are often, and I know this from like the clients and some folks I know, that they may find themselves like that they define themselves either by their diagnoses,
Right.
which the medical system is set up to help you collect those,
Sure.
And or their trauma.
Uh-huh.
So their trauma story really almost imposes limits on what they feel like they're able to achieve.
Yeah.
And it seems to me from your approach here that there's a liberation or freedom that becomes possible for people when they're not defined by their diagnoses or their trauma.
Right.
Like you all respect their journey, but you say this is a very brain-based, nervous system-based approach, and we're tailoring it according to what's got you in protection mode and how can we gently move you to growth mode through a neurological, brain-based approach.
Through a brain-based approach.
Is that right?
That's,
So,
I mean, I don't think I could have said it better myself. I really wish I had the record button. That would have been great. And oh, nice. And so, this is, I hesitate to use this example, but I'm going to use it anyways, because it's not mental health per se, but it was my first experience with this type of thing and one of my own health issues, which was growing up with asthma. And so, yes, I had asthma, and I didn't go to a chiropractic neurologist. I didn't go to anyone who did brain-based care. I went to a chiropractor, and I went because I couldn't turn my head, and I was bartending at the time. And that's a big move for a bartender. Hey, what do you want? Right? So you got to be able to do it. And he didn't talk anything about this stuff. He just said, hey, we're going to get your system working better. That was his only words. And after I got worked on, yeah, I could turn my head better. But then weeks went by, and I realized I haven't had to use my inhaler. What is going on? And then I would purposely try to ask him. And then I would not understand his answer. Like, hey, I've got asthma, and then I haven't had any asthma attacks. And he's like, oh, that's great. Let me know how that keeps going. And then I'm like, do you not care what I just said to you? And he did. He understood exactly what I was saying, but he was coming at it from a completely different mindset. And at one point, he just said, okay, well, let's talk for a second. Here's your autonomic nervous system. Your respiratory, your ventilation, all of this is controlled not by your conscious mind, but by your system, right? And if we can help that system do it more effectively, and that's all he did. And I said, oh, right? And it just made sense to me, And so I think that's kind of the thing we talked about, which is, at some point, something just clicks. And the person, it says, oh, this makes sense. Yeah. But you're right. The hardest thing is, I said, the bias of your coming in. Like, I have X, Y, Z. And it's like, so I don't try to take that away from the person. That's kind of an exercise in futility. I was just like, okay, let me know how that goes. Or yeah, I am a. Yeah. And I think people need that, because in some level, look, on some level, we all, doesn't matter what we do, we talk about symptoms, right? And if we don't, then it's like, you just look at each other, and at some point you're going to do it, right? And so I think it's just how it's handled. Do you give all the power to it or not? And so I see my role as not just, I'll listen, and then once we're done, then we're going to move on. And then, but I say my piece, right? Like, hey, that's cool, but we're not going to work directly on that. We're going to work on this system. Yes?
Just a comment. I also feel like taking an approach that is like less personal helps the client see their trauma or their experience as something that isn't that personal, and helps them have a more 3D perspective of it and be able to see it from like a different viewpoint.
Right.
That makes them realize like, oh, this is something that's happened for me, so I can now be in this office and receive treatment and be better than I could be before, instead of a victim mindset more so.
Yeah. Yeah. Well, it's a good point. Yeah. Did we hear that online?
I think so.
Okay. Anybody else?
I got another question.
All right.
Well, it's not mine, but how do you guard your emotions as a parent?
I think you're going to have to ask a parent, Some things I can answer, other things I just don't know if I can. So I think it's a great question. And maybe that person can reach out to me and I can give them a better answer at a later date, because not being a parent, I don't think I know the best answer for that.
That's fair.
Yeah. I had a dog. That was hard. Seems like a lot harder if they're human, you know? So, well, you guys have been a fantastic audience. I do want to thank you for your time and your attention. And you had places to be, I'm sure, but you chose to be with us. And so I thank you for being here and paying attention. You're welcome. Thank you.